Good afternoon, everyone. Myself Priya Salvi, and my topic is antiviral drugs, in which I am going to explain you the antiretroviral drugs. First of all, what do we mean by retroviruses? The viruses which have the enzyme reverse transcriptase is known as the retroviruses. HIV virus is a retrovirus. Then, what do you mean by antiretroviral drugs? The antiretroviral drugs are the drugs which acts against the HIV infection. It is useful in prolonging and improving the quality of the life by postponing the complications of AIDS. Antiretrovirus drugs include the many subclasses. First is the nucleoside reverse transcriptase inhibitors, NRTIs. The drug includes zidovudine, diadenosine, sorry, stavivudine, lemivudine, abicavir, antricitabine, and the tenofovir. The non-nucleoside reverse transcriptase inhibitor are the NNRTIs. The drug include nevirapine, efavirenz, delavirdine, etravirine, and the rilpivirine. Now the protease inhibitors. The drug include ritonavir, atazanavir, indinavir, nelfinavir, sacuinavir, fosamprinavir, lopinavir, and darunavir. Entry inhibitors, enfuviretide, CCR5 receptor inhibitor, maraviro, and the integrase inhibitor, raltegravir and the dolutegravir. Now we'll see the mechanism of replication of HIV virus. Once the virus infects our body and enters into our cell, the uncoating takes place. Now the viral RNA gets converted into viral DNA with the help of an enzyme reverse transcriptase. Then this viral DNA gets incorporated with the host DNA with the help of an enzyme known as integrase. Once they integrate with the host DNA, now the transcription occurs and the viral mRNAs are formed. Then the translation takes place and the viral proteins are formed. Now with the help of the enzyme protease, maturation and the release of the new viral proteins takes place. Now, how does the antiretroviral drug works? It works via three mechanisms. The first is the reverse transcriptase inhibitor, second is the protease inhibitor, and the third is the integrase inhibitor. First, we'll see the reverse transcriptase inhibitors. The drugs which acts via inhibiting the conversion of the RNA into the DNA are known as the reverse transcriptase inhibitors. This includes two subclasses. One is the NRTIs and the other is the NNRTIs. NRTI is the nucleoside reverse transcriptase inhibitors. It further includes two main classes, that is nucleoside RTIs and the nucleotide RTIs. Both are the competitive inhibitors. Now what do you mean by competitive inhibitors? The drugs which competes with the substrate for binding at the substrate binding site at the enzyme. So they compete with the substrate at for the same binding site at the enzymes. Now the NNRTIs. This is a non-nucleoside reverse transcriptase inhibitors. They are the non-competitive inhibitors. So they have the binding site on the enzyme other than the substrate binding site. First, now we'll see the nucleoside reverse transcriptase inhibitors. The nucleoside reverse transcriptase inhibitors first infects the HIV cell. Then, as they are the nucleosides, they will be converted into nucleotides. That is a triphosphate form with the help of an enzyme cellular kinase, and then they competitively inhibits the HIV reverse transcriptase enzymes. One of the main drugs of NRTIs are the zidovudine. It is a prototype member of NRTIs. It works on HIV-1 virus as well as HIV-2 virus. It is a thymidine analog. It has two functions. One, it inhibits the reverse transcriptase enzyme, and second, it itself gets incorporated with the proviral DNA and terminates the chain elongation. So when the phosphorylation takes place, they are converted into zidovudine triphosphate, then which inhibits the reverse transcriptase. Second, zidovudine itself gets incorporated into the proviral DNA and terminates the chain elongation. Now we'll see the major interactions of zidovudine along with the other drugs. First is the paracetamol. Paracetamol increases the AZD toxicity by competing for the glucuronidation. That is, paracetamol and the AZD both gets metabolized by the body by the process of glucuronidation. Then, as the paracetamol competes with the AZD, the metabolism of the AZD decreases and its toxicity in the body increases. Second is the azole, the antifungal drugs. It inhibits the AZD metabolism, leading to its toxicity in the body. Now, third, Stavivudine and the zidovudine exhibit the mutual antagonism by competing for the same activation pathway. Stavivudine is another drug which belongs to the NRTIs only. This is also a thymidine analog, therefore it competes for the same activation pathway. Now the another drug, that is tenofovir. Tenofovir is the only drug which is a nucleotide RTI. The rest all are the nucleosides. It is useful for the HIV as well as for the hepatitis B infections. The side effects include, it is a nephrotoxic, so it is contraindicated in the renal patients. It causes Fanconi syndrome. What do you mean by Fanconi syndrome? When the PCT cells of the body gets damaged, there is increased loss of electrolytes from the body, and the major electrolyte which is lost is the phosphate. Due to the increased loss of phosphate, there is chances of osteoporosis and the rickets. Therefore, this drug is avoided in children. Now we'll see which drugs. There are drugs which can also be used in the hepatitis B infection. There are three drugs. One is the tenofovir, second emtricitabine, and the third is the lamivudine. These are the three drugs which can be also used for the hepatitis B infection. Now the side effects of NRTIs. First, it causes bone marrow suppression, anemia, and the thrombocytopenia, which is maximally seen with the zidovudine. Second is the muscular side effect, myopathy, which is also maximally seen with the zidovudine. Pancreatitis, which is maximally seen with the diadenosines. Peripheral neuropathy, which is maximally seen with the stavivudine. Liver steatosis, which is also maximally seen with the stavivudine. Lactic acidosis. Now these two are the specific side effects of a particular drug. That is, aphthous ulcer is seen in the zalcitabine, and the abacavir causes an allergic reaction, that is hypersensitivity reaction. So if a patient develops hypersensitivity reaction, so the abacavir drug is stopped in that patient and will not be given again to that patient. Non-nucleoside reverse transcriptase inhibitors, NNRTIs. This directly and non-competitively inhibits the HIV reverse transcriptase. These are active against HIV-1 virus but do not has no effects on the HIV-2 viruses. Side effects of NNRTIs. The common side effect is it causes skin reactions. Nevirapine is hepatotoxic, and the efavirenz causes neuropsychiatric symptoms and the gynecomastia. Now we'll see the protease inhibitors. Protease inhibitors inhibit the post-translational modification of the proteins, and therefore inhibits the production of the new viral protein particles. First, the protease inhibitors competitively inhibits the HIV protease enzymes, and it prevents the cleavage of viral polyprotein into functional, structural, and the enzymatic components of HIV, due to which the immature non-infectious viral particle proteins are produced, and the infection of the other cells is prevented. Note: protease inhibitors are not used in the monotherapy as they develop the resistance over months. Therefore, they are used in the combination with other NRTIs. Side effects of protease inhibitors. The common side effects include nausea, vomiting, and diarrhea. They also produce skeletal muscle wasting, lipodystrophy, insulin resistance, and diabetes. Now we'll see the third group of drugs, that is integrase inhibitors. This inhibits the integrase enzyme. Therefore, it prevents the integration of the host DNA, viral DNA with the host DNA. It is effective against both HIV-1 and HIV-2. It is useful. It is used along with the two NRTIs for the better efficacy, less frequent dosing, and better tolerability. Side effects of integrase inhibitor. Dolutegravir causes the rashes and are hepatotoxic. Raltegravir causes the muscular side effects, that is myopathy. Now the MCQ questions. Question number 1. Enzyme required for the incorporation of the viral DNA into the host DNA. Options. Option A, reverse transcriptase, B, integrase, C, protease, and D, endonuclease. The answer is option B, integrase. Question number 2. Tenofovir drugs belongs to which category of antiretrovirus drug? Options include A, NRTIs, B, NNRTIs, C, protease inhibitors, D, CCR5 receptor inhibitors. The answer is A, NRTIs. Question number 3. Everything is correct for the drug zidovudine except. Options include A, prototype member of NRTIs, B, active against HIV-1 and HIV-2, C, act by getting incorporated into the proviral DNA, D, it is a member of protease inhibitor drugs. The answer is D, it is a member of protease inhibitor drug. Question number 4. Aphthous ulcer is a side effect seen maximum with. Options are diadenosine, B, stevivudine, C, zalcitabine, and D, abacavir. The answer is zalcitabine. Question number 5. All are the side effects of integrase inhibitor except. Option number A, rashes, B, hepatotoxic, C, liver steatosis, and D, myopathy. The answer is liver steatosis. Thank you.